Hello, my name is Thomas Gray. I'm a student physical therapist at Rocky Mountain University. I'm working under the guidance of Dr. Clausen today. I'm here to demonstrate electrical stimulation for pain control. My patient today is a 65-year-old patient who has knee osteoarthritis. They are reporting 8 out of 10 in pain, as well as on a pain scale, and in pain with walking and standing for more than 15 minutes. So they just finished their therapy session, and so we are going to be doing some electrical stimulation to help with that pain. So specifically, I'm going to be using low rate TENS, also known as acupuncture. What that is designed to do is to release endogenous opioids from the body itself to help with pain management after therapy, up to a few hours post. So some contraindications that I want to ask the patient is if they have any active cancer, if they are pregnant, if they have a pacemaker. I want to see if they demonstrate poor mentation, as well as check for any sensation issues before we start. So patient, I'm going to ask you some questions, and I just want you to let me know if you have any of these, okay? So do you have any active cancer that you know of?
Nope.
No? Are you possibly pregnant?
Nope.
Do you have a pacemaker?
Nope.
No. And then before I kind of put my hands on you, I wanted to make sure that I have your consent. Basically, I'm just going to be putting some electrodes on your thigh and your knee. Is that okay with you?
Yep.
All right. And I also just want to check the sensation. Is it okay?
Mm-hmm.
All right. So I'm just going to check above and below the knee. Do you feel any different sensations there?
No.
No? All right. Perfect. So then I'm going to start setting up the machine. So I'll take the camera. So for low rate TENS, I'm going to do biphasic. I want to put it on continuous. The frequency, I want to drop down to below 10. I'm going to set it to 4. Okay. And then the width, 200 is about the minimum that we want, but I'm going to bump it up to about 250, maybe 260, just so I have, because it's a larger area of the body, I want to make sure that we get stimulate both the A alphas, the A betas, and the A deltas, specifically those A deltas with the noxious stimuli for the opioids. I'd usually use a larger lead or pad, but the larger ones aren't very sticky today. So, patient, I'm just going to be putting these above and below your knee, okay? And
Okay.
that just kind of helps target that release of those opioids. So the sensation while I'm putting these on is basically there's going to be some muscle contraction here. It's not going to be like a strong, solid contraction. It's going to be like pulsating almost. And that's what we want. It shouldn't be, it's going to be stimulating some fibers that will cause a little bit of discomfort. So that is kind of what we're going for. It should not be super uncomfortable that you are intolerable. So that's kind of what I want to expect, or you to expect with this. Do you have any questions before we start?
Nope.
No? All right. So then the intensity is subjective to the patient. So I'm going to just start up just slowly, and then I want you, patient, to let me know when you start to feel kind of that little pulsating, okay? We'll keep going up from there.
Okay.
And then time, set it to about a minimum of 20 minutes to about 45 minutes. That's kind of like the window that we want for today. I'll set it for 20 minutes. We will only do like about a minute max just for time's sake for today. All right, so patient, I'm gonna start increasing the intensity, okay?
Okay.
All right. Let me know when you start to feel that little pulsating sensation.
A little bit.
A little bit, okay. All right, just keep going up a little bit higher. You feel anything there?
A little bit.
A little bit. I'm going to bring it down just a little bit. I want to make sure that this one down here is properly on. Okay. Does it change anything there?
Kind of.
A little bit? Okay. Is it okay if I keep going up?
Mm-hmm.
All right. I'm going do the same thing over here, just making sure that these are all kind of staying on. Anything there?
Almost.
Oh yeah, I see it there. Okay. You can give a little higher. How's that there?
That's good.
Right there. Okay, so I'm going to start it now. 20 minutes. We'll go for just about a minute here. And as you can see, the muscle is contracting in a pulsating rhythm. And that's kind of just what we want to see. And that's going to help with the opioid release. All right. And an important part with these is you just want to make sure to check the skin integrity afterwards. Just checking for any redness, any discoloration, and then just checking that skin integrity, which I'll do once I'm finished. All right, we'll just go for about 22 more seconds. Nice rhythmic contraction. There. All right, so I'm going to take these off carefully, and I'm just checking for the skin integrity, like I said. And I'm just doing a quick check. Does it feel any different here than before in terms of like the sensation?
Nope.
No. All right. So hopefully that's going to help with the pain relief. Okay.
Okay.
All right, and that's all for electrical stimulation for pain control.